Hello, everybody. My name is Becca Boss. I am a PA here at Westlake's Dallas location. Um, Thank you for joining us. We're going to be going over IPL today and why this is one of my favorite treatments, kind of like going into the nitty-gritty about why things work, how they work, and why this might be a good treatment option for you. So let's get started. So, depending where you guys are watching from, as you may know, we have multiple locations. Most locations are in Austin, a couple in Houston, a couple San Antonio. I am at the Dallas location. There's only one location here. And so, what I really like about Westlake is we have kind of a shared platform online. So, as a patient, it's convenient for you to be able to go from location to location because if you are getting treatment, say in Houston, if you're in Dallas and you're like, I need to treat myself to something cosmetic or acne flare or something like that, you just come into your closest office and we'll be able to just kind of resume your care. So that's nice. And for those of you who are familiar with our Dallas office, or if you live in Dallas, as you know, we are conveniently located just north of downtown. We're right across the street from SMU. All right. And a little bit about me. So I have been a PA for about 7 years. I went to Texas Tech and PA school, went to UNT in Fort Worth, and went to grad school, randomly kind of dabbled in some neuroscience. Why that is relevant is as a provider, I love understanding kind of like all of the fine tune, again, nitty gritty. Why do things work? Why would I choose this treatment option? And I think it's important to be able to educate patients a little bit, not overly, but to help you best determine, are you getting treatment from someone who is a qualified provider and they know what they are doing? And then also helps you understand what treatment options might be the best for you. So let's segue into what is IPL? IPL stands for intense pulse light. It's also known as a photofacial. It's not technically a laser. I'm just going to call it laser just because easier to refer to it that way. It's been around for a while. So they first invented it early 90s, kind of refined it for cosmetic treatment early 2000s, and it's been around such a long time that we've also kind of fine-tuned IPL in and of itself. So there's different types of IPL, which we can get into in a little bit. What you would use IPL for is great at addressing things like skin tone, sun damaged spots. You can use it for redness, so things that we call vascular lesions. Um, it's not going to be your go-to option for helping with skin laxity, deeper wrinkles. This is more going to be targeted for like a superficial skin change improvement. So again, in the picture here, you can see it helps with like sunspots, some genetic type of age spots that have pigmentation. You actually can get improvement in that too. In this presentation, I'm going to focus kind of on improvement of pigmented spots, so like sunspots. Um, IPL is similar to laser hair removal. Laser hair is actually kind of like a fine-tuned type of IPL. So when you're doing IPL, if you're doing it over an area where you have dark hair growth, you can, whether intentionally or unintentionally, actually get some like a mini laser hair treatment too. Okay, how does it work? So this is what I was talking about earlier when I just like to explain and understand how things truly have a benefit for patients and why I might choose this treatment for someone over somebody else. Because when you understand the science of it, you understand why you would do this. So, with IPL, how it works is when you administer basically a focused area of bright light to an area where you have pigmentation, the energy from that light is absorbed by the cluster of pigment. With the cluster of pigment, once it absorbs that energy, it turns it into heat and turns the little pigmented spots into like little crispy areas that then come to the surface of the skin and they exfoliate away. So this is different from a true laser just because this is kind of like a bright flash of light in a very precise area, whereas a laser is more of like a very fine-tuned kind of focus of energy. So kind of disregard the graph there. That's too sciencey, but I like the pictures on the bottom where it kind of shows you the progression of what you can get with multiple treatments. Um, that progression down there, usually you can get better improvement after one or two treatments. This goes up to six treatments to get that type of lightening, depending on settings you're using. And if you're doing appropriate aftercare and prep, you can usually get improvement a little bit quicker than that. So I think next slide is actually going to be a picture before and after. Yeah. Okay, so this patient, this is actually one of my friends. Her name's Christy. She's in her late 30s. And I intentionally chose her as a model because I wanted to show what IPL can do specifically just for pigmentary changes. So again, it's not going to be your go-to choice if we're dealing with, loss of skin volume, really deep wrinkles. So I didn't want that to be a type of a distraction almost in before and after pictures. Christy still has very healthy skin. She has plenty of volume. And there, you can see in her befores, there's quite a bit of sun damage. And so essentially the reason, and the next slide is going to be kind of zoomed out a little bit, but essentially the reason I chose her and why I chose these pictures is you can just see what this laser treatment is best at doing. So I will say in the after pictures, she did come in wearing a little bit of a tinted sunscreen, but pay attention to her nose. So she really wanted me to avoid her nose because she liked the look of her freckles or sunspots on her nose. And so you can see how good of a job the laser did at getting rid of sun damage. Even though she has a little bit of a tint on her face, it's not covering a whole lot of the aftermath because you can still see the freckles there. So this is pretty good improvement. This was only one treatment and this was 2 weeks out. And then this is kind of the zoomed out version. And I did just want to say, because I didn't mention this at the beginning, if anybody has questions, because I know I'm just talking fast, information overload right now, at the end of this, you'll be able to submit some questions and we'll go over anything, you guys are curious about. Okay, but yeah, zoomed out view of the before and after for Christy. Again, you can see before a lot of sun damage. For her, I was really aiming to get rid of the pigmented spots, but you can see it actually had a pretty good benefit for some of the vascular damage too. And front view here, again, she's wearing a tinted sunscreen, but look at her nose. She wanted me to keep some of those little freckles. And so you can see how good of a job this laser did with just the one treatment at clearing up all the other areas. And I added these pictures because I really also just wanted to emphasize for something like retexturization, helping with pore size, like you can see she has some under eye hollowing. Treatments like that, we're going to want to consider multiple other types of treatment modalities. It's not going to be IPL. So IPL again is great for superficial skin improvement with discoloration. Okay, so for you as a patient, how do you prepare for this? How do you know if you're a good candidate for it? I will say that for something like IPL, it's great to get to meet you as the patient first before we kind of come up with a treatment plan. Because everybody's skin is different. Everybody's going to realistically need to talk about expectations. Are you going to get benefit from one treatment, a couple treatments? But for optimal results, regardless of your situation, you need to stay out of the sun before and after treatment. I would say it's almost important, if maybe not even more important, to stay out of the sun for sure 2 weeks before your treatment. Because if you come into your treatment and you have any type of a sun tan, when we're administering the laser, then the light energy, remember, it's getting absorbed where you have pigmentation. So you're just going to have overall skin lightening. It's not going to be able to detect here's a baseline tan, here's a couple sunspots. So you really need to come in with just kind of your natural base skin color. Afterwards, same thing. You want to stay out of the sun for 2 weeks because if you go out in the sun right after your treatment, those sunspots just come right back. You would want to prepare beforehand by just doing gentle skincare stuff. So no retinoids, nothing that's super exfoliating, aggressive. Um, Something else that's very important is you want to ensure you are getting this treatment by somebody who is well versed and educated on the potential risks and side effects. I saw one patient who had history of lupus and they got IPL at an outside clinic. And that is a specific medical condition where if you have exposure to light, it can flare it. And so I saw that patient, she was like, I had IPL, like my pigmentation, the sunspots are better, but my lupus is going crazy. So something to keep in mind, there are multiple medical conditions that can get exacerbated with heat and light energy, and same with some medications. So you just want to be able to disclose all of that before you go through a treatment. And then super important, you need a good sunscreen. After IPL, you're going to be a little bit dry, kind of flaky for the first week or so. And so you want to make sure sunscreen and a good moisturizer. So, say you come in, you get treatment, which the treatment itself can take 20 or 30 minutes. Right after, you're going to see the areas that we treated actually look a little bit darker. So, think back to that original slide where we're kind of showing how the laser works. You are gonna see those little pigmented areas get darker because they absorbed all of that light energy, turned it into heat, and now they're turning into kind of little crusty spots on the top of skin. So it can be alarming initially because it's like all of these spots look darker. That's actually a great sign, and it means that you're gonna have ultimately better results. First couple of days, you're going to be kind of red. Your skin's going to be tight. You're going to be dry. Days, and this is variable, days 3 to 10, you're going to get really dry, kind of like a coffee ground texture feel to your skin. Again, that's the pigmentation coming to the surface of the skin and it's trying to exfoliate itself away. Days 10 to 14, depending on how quickly your skin is healing, that's where you're going to see best results. So with Christy, let me go back a couple slides. This was 14 days, I want to say. She came back and we did the after pictures. So she was really careful. She stayed out of the sun, but pretty quick turnaround, good results. This is just another before and after of another patient I did. This too was after only one treatment. So she got amazing results. The after is when she came in for her second round of IPL. So we hadn't done it yet. But you can just see with one treatment how great of improvement she had. And so just imagine, we did 3 treatments on her, how good ultimately it's going to look. Okay, so going back just generally to IPL, because I know, again, this was a lot of information. You can treat any part of your body where there's pigmentation that we want to improve. So you can do back of hands, you can do forearms, face, chest. Again, it's going to be dependent on the patient and the situation, how many treatments you might need, how aggressive we can go with the settings. So I would just strongly encourage that you find a reputable provider. I love doing IPL just because I find the results so satisfactory afterwards. And what I really appreciate about the device that we have in office is it's highly customizable. So you can adjust all of the heat settings, you can adjust how intense, how gentle you want the procedure to be. And it's ultimately for the patient's benefit because we are getting the results that you're looking for in the quickest time frame too. Um, feel like there might be some things that I skimmed over, but we'll get back to that. We'll get back to any questions here in a second. If you are interested in IPL, learning more about it, again, I'm at our Dallas location. We have our number here. And then if you are watching webinar and you want to just reach out to us directly via email, that is our front desk's email, dupfd at Westlake Dermatology. Shoot us an email and you can say, hey, I watched Becca's webinar and interested in getting scheduled. Because you watched, which I appreciate your time, I'm offering 20% off of any IPL treatment if you book during the month of June. New patients would love if I could do a consultation too, just to get an idea of what kind of your expectations are, see if IPL is the best option for you, and we'll get you treated. During the month of June, because there's going to be a lot of sun exposure, you just may need to do some prep work and stay out of the sun, come in with any questions you might have, and we'll get a treatment plan set up for you. That said, I think this is my last slide. Let's go over some questions if y'all have anything. Let me know. I have our office manager here in the room with us. Her name is Sneha. If anybody wants to reach out and get scheduled, you may be chatting with her. And so she's kind of just in the background helping me out with questions here.
And it looks like someone in the chat box asked the difference between IPL and Fraxel.
Okay. So we had someone ask what the difference is between IPL and Fraxel. Fraxel is a true laser treatment. What that is doing is it's helping to target deeper structures in the skin. So it can help stimulate collagen and elastin. It can help with revolumization of the skin. So a patient I might recommend Fraxel for is going to be someone who has lost some skin volume or they have deep wrinkles, a lot of sun damage. You can use Fraxel settings to be on a more superficial setting, so you can get some improvement of sunspots. But with IPL, essentially, you are able to address a larger range of pigmentary change, whereas with Fraxel, it's a very specific wavelength that you're using to help with pigment. So IPL is kind of your catch-all for pigment. Think of Fraxel as more so helping with adding some volume or plumpness to your skin and a little bit of pigmentation improvement on the side.
Another person asked, will IPL completely remove sunspots or will they come back over time?
So next question, is IPL going to completely remove everything? Will they come back with time? If you are super cautious in the aftermath and staying out of the sun, wearing your wide brimmed hat, sunscreen, the spots that we treat ideally are gone for good. Granted, you may need 2 or 3 treatments to get those type of results, but if you are very cognizant of your sun exposure immediately after treatment, ideally they're gone. That's not to say that you may not get more sunspots that show up with time, because you can get sunspots or freckles that show up from previous years, just an accumulation of sun damage. And so ultimately you may get some spots that show up, not necessarily going to be the same ones though.
Another good one, does it hurt and what does it feel like?
Oh, that's actually a great question and something I totally skimmed over. Someone asked, does it hurt? What does it feel like? So the little hand piece that I use is something that kind of just goes over your face, and I do different kind of pulses of light. With each pulse of light, there's kind of like a rubber band snap sensation, but that is something that we make more comfortable by using ultrasound gel on your face. That's very cool. So it's kind of that some of that's absorbing some of that heat energy. It makes it more comfortable for you. We also use a handheld fan that is really cold too. So you're kind of distracted by all of the cooling sensations going on. Usually people do just fine with it. It can be a little bit uncomfortable if we're doing a larger treatment area. And so there is the option to come in for numbing beforehand, but cold ultrasound gel, using a fan, people do fine.
Do you end up needing to take a pain reliever after the procedure and how soon after can I wear makeup?
Okay. Do you need a pain reliever afterwards? And how soon can you wear makeup? Pain reliever, not usually. I will say you can get better results if you ice on and off for the following few hours, even, up to the next day after the treatment. That can be a form of helping with a little bit of pain relief. Um, Some people have a propensity to swell a little bit after laser treatments or IPL. So something like Tylenol, if that's something where it's safe for you to use, is going to help with the side effect of swelling and any discomfort. Um, what was the second part of that question?
Makeup
Oh,
afterwards.
makeup. With makeup, so immediately after the procedure, I like to do a tinted sunscreen. And so, with that tinted sunscreen, when you leave here, you drive home, whatever you might be doing that day, you do have theoretically like a little bit of tint slash makeup on your skin. I even do this for male patients. However, I don't recommend doing a really thick foundation or concealer because when you are washing your face off, inevitably you're going to be exfoliating that skin and it's going to be really irritating. So I like to say hold off on makeup for a few days. It's okay to wear a tinted sunscreen as long as it's something lightweight. And when you wash your face, you're using a gentle cleanser. Makeup a few days. If you want to be extra cautious, 2 weeks. Realistically, that's not going to be able to be feasible for everybody, but 2, 3 days.
The last question that I have right now is, does IPL help melasma or could it make it worse for me?
Okay, that's another really great question. So, question was, can IPL help melasma? Will it make it worse? So, similar to what I was kind of saying about the patient I saw who had lupus, that her lupus got worse with the exposure to the light and heat energy. Some people's melasma can and will flare with exposure to light and heat. So, myself personally, I have melasma. I can't do IPL on very aggressive settings because it will flare my melasma a little bit. That's not going to be your go-to treatment for a patient who has melasma. I would recommend if you have melasma, come in, we'll do a consultation, look how severe melasma is. Oftentimes, patients think they have melasma, and it's not truly melasma, it's just extensive sun damage. Um, so it's kind of just variable dependent, patient to patient, but it's not something advisable if you have already diagnosed melasma. Another thing that I get a lot of questions about from patients is what's the difference between IPL and BBL? So think of IPL as being your kind of like umbrella term for the treatment. BBL is a very specific type of IPL that was created by a certain type of a brand. So all BBL treatments are IPL. Not all IPLs are going to be a BBL. BBL is more of like a very fine-tuned type of a treatment. So that's not something we offer in our Dallas office. I believe some of the Austin locations have BBL. BBL can be a little bit more pricey, and it's something where the settings are more variable. Again, you can make them more precise or fine-tuned for the patient. IPL, generally speaking, is your more generalized, kind of like a vague treatment. However, that's not to say that IPL is a lesser than treatment than BBL. With the appropriate settings and with a provider who kind of is able to address what you're looking for, you can get excellent settings. I mean, you can get excellent results with just one IPL treatment. IPL tends to be, generally speaking, a little bit more financially friendly, and not everybody needs BBL. So we can go into more detail about that if you have questions. Long story short, kind of the same thing. BBL is for more specific skin conditions. IPL is a generalized treatment that works well for sun damage. And I think that's all the questions. I'm probably going to think of something else when I get off of here, but if it's important, I will post it on my work Instagram page. I did not add the link here, but my work Instagram is beccaboss.pa. And I like doing educational stuff on social media too. So if you guys have any questions about anything else, reach out to the email you see on the screen. You can contact me on social media. You can call our office, and happy to do more webinars in the future too. We'll go over whatever you guys have questions about. But thank you so much for tuning in on your lunch break. What time is it?
12:26.
12:26. So we still have 30 minutes for you guys to enjoy the lunch hour before you have to go back to work. So thank you for tuning in.